100 questions plus answers competency test. Internal Medicine 1. A 45-year-old man presents with left-sided chest pain radiating to the arm for 20 minutes. The ECG shows ST elevation in leads V2 V4. What is the diagnosis? Answer: acute anterior myocardial infarction. 2. What is the first-line medication for a hypertensive patient without comorbidities? Answer: ACE inhibitors or ARBs. 3. A patient with hypertension and proteinuria. What is the recommended antihypertensive medication? Answer: ACE inhibitors. 4. A patient with diabetes mellitus and an HbA1c of 9%. What is the recommended first-line treatment? Answer: Metformin. 5. What is the main complication in chronic kidney disease patients? Answer: anemia due to erythropoietin deficiency. 6. A patient with a history of right upper quadrant pain, fever, and jaundice. What is the diagnosis? Answer: acute cholangitis, Charcot's triad. 7. What is the most sensitive diagnostic test for pulmonary tuberculosis? Answer: sputum microscopy for AFB, Zeal-Nielsen. 8. A patient presents with epigastric pain after meals and a feeling of fullness. What is the most likely diagnosis? Answer: functional dyspepsia. 9. A patient with a chronic cough lasting more than 3 months per year for 2 consecutive years. What is the diagnosis? Answer: chronic bronchitis. 10. A patient with acute dyspnea and wheezing. What is the diagnosis? Answer: acute asthma exacerbation. 11. A patient with bilateral leg edema and lung crackles. What is the most likely diagnosis? Answer: right-sided heart failure. 12. What is the most important laboratory test for systemic lupus erythematosus? Answer: ANA, anti-nuclear antibody. 13. A patient with microcytic hypochromic anemia. What is the most likely cause? Answer: iron deficiency. 14. A patient with acute asymmetric joint pain in the big toe. What is the diagnosis? Answer: gout arthritis. 15. A patient with unilateral leg edema, redness, and pain. What is the diagnosis? Answer: deep vein thrombosis, DVT. 16. What anticoagulant is used for venous thrombosis prevention? Answer: heparin or warfarin. 17. A patient with pale skin, fatigue, and hemoglobin of 7 grams per deciliter. What is the most likely cause of normocytic normachromic anemia? Answer: anemia of chronic disease. 18. A patient with elevated ALT and AST levels and positive HB-ZAG. What is the diagnosis? Answer: chronic hepatitis B19. A patient with high fever, chills, splenomegaly, and a history of travel to an endemic area. What is the diagnosis? Answer: malaria. 20. A patient with recurrent diarrhea, malabsorption, and dermatitis herpetiformis. What is the diagnosis? Answer: celiac disease. 21. A patient with chronic GERD, weight loss, and progressive dysphagia. What is the diagnosis? Answer: esophageal adenocarcinoma. 22. A patient with proximal muscle weakness and elevated CPK levels. What is the diagnosis? Answer: polymyositis. 23. A patient with chronic fatigue, low blood pressure, and skin hyperpigmentation. What is the diagnosis? Answer: Addison's disease. 24. A patient with blood pressure greater than 180/120ths of a millimeter of mercury and target organ damage. What is the diagnosis? Answer: hypertensive emergency. 25. What is the first-line medication for hypercholesterolemia? Answer: statins. 26. A patient with typhoid fever, altered consciousness, and delirium. What is the diagnosis? Answer: typhoid encephalopathy. 27. A patient with hemoptysis, chronic cough, and a cavitary lesion on chest X-ray. What is the diagnosis? Answer: pulmonary tuberculosis. 28. A patient with sudden onset dyspnea, cyanosis, and elevated jugular venous pressure. What is the diagnosis? Answer: pulmonary embolism. 29. A patient with bilateral knee pain that worsens with movement. What is the diagnosis? Answer: osteoarthritis. 30. A patient with severe headache, photophobia, and neck stiffness. What is the diagnosis? Answer: meningitis. 31. A patient with a history of alcoholism, weakness, and muscle pain. What is the diagnosis? Answer: alcoholic myopathy. 32. A patient with pallor, dyspnea, and hemoglobin of 5 grams per deciliter. What is the diagnosis? Answer: severe anemia. 33. A patient with hyponatremia and elevated ADH. What is the diagnosis? Answer: SIADH, syndrome of inappropriate antidiuretic hormone. 34. A patient with hematuria, proteinuria, and hypertension. What is the diagnosis? Answer: acute glomerulonephritis. 35. A patient with a history of seizures and elevated serum calcium. What is the diagnosis? Answer: primary hyperparathyroidism. 36. A patient with fever, migratory arthritis, and a new heart murmur. What is the diagnosis? Answer: rheumatic fever. 37. A patient with jaundice, elevated direct bilirubin, and high ALP. What is the diagnosis? Answer: intrahepatic cholestasis. 38. A patient with low blood pressure, rapid pulse, and pale skin. What is the diagnosis? Answer: Hypovolemic shock. 39. A patient with polyuria, polydipsia, and hypernatremia. What is the diagnosis? Answer: diabetes insipidus. 40. A patient with a history of gout and acute kidney injury. What is the diagnosis? Answer: acute urate nephropathy. 41. A patient with high fever, petechia, and thrombocytopenia. What is the diagnosis? Answer: dengue hemorrhagic fever. 42. A patient with a history of hepatitis B and a mass in the right upper quadrant. What is the diagnosis? Answer: hepatocellular carcinoma. 43. A patient with altered consciousness, hypoglycemia, and hepatomegaly. What is the diagnosis? Answer: hypoglycemia due to liver disease. 44. A patient with anasarca, massive proteinuria, and hypoalbuminemia. What is the diagnosis? Answer: nephrotic syndrome. 45. A patient with multiple joint pain, facial rash, and proteinuria. What is the diagnosis? Answer: systemic lupus erythematosus. 46. A patient with hypertension, hypokalemia, and elevated aldosterone. What is the diagnosis? Answer: primary hyperaldosteronism. 47. A patient with dyspnea and pleural effusion. What is the main diagnostic test? Answer: thoracentesis. 48. A patient with acute kidney injury due to tubular necrosis. What is the diagnostic test? Answer: urinalysis. 49. A patient with dysphagia to liquids and solids, and esophageal dilation. What is the diagnosis? Answer: achalasia. 50. A patient with chest pain, fever, and pericardial friction rub. What is the diagnosis? Answer: acute pericarditis. 51. Patient with chronic GERD, weight loss, and progressive dysphagia. Diagnosis? Answer: esophageal adenocarcinoma. 52. Patient with proximal muscle weakness and elevated CPK. Diagnosis? Answer: polymyositis. 53. Patient with chronic fatigue, low blood pressure, and skin hyperpigmentation. Diagnosis? Answer: Addison's disease. 54. Patient with blood pressure greater than 180/120ths of a millimeter of mercury and target organ damage. Diagnosis? Answer: hypertensive emergency. 55. First-line drug for hypercholesterolemia? Answer: statins. 56. Patient with typhoid fever, altered consciousness, and delirium. Diagnosis? Answer: typhoid encephalopathy. 57. Patient with hemoptysis, chronic cough, and cavitary lesions on chest X-ray. Diagnosis? Answer: pulmonary tuberculosis. 58. Patient with sudden onset dyspnea, cyanosis, and elevated jugular venous pressure. Diagnosis? Answer. Pulmonary embolism. 59. Patient with bilateral knee pain that worsens with movement. Diagnosis? Answer. Osteoarthritis. 60. Patient with severe headache, photophobia, and neck stiffness. Diagnosis? Answer. Meningitis. 61. Patient with a history of alcoholism, muscle weakness, and muscle pain. Diagnosis? Answer. Alcoholic myopathy. 62. Patient with pallor, dyspnea, and hemoglobin of 5 grams per deciliter. Diagnosis? Answer. Severe anemia. 63. Patient with hyponatremia and elevated ADH levels. Diagnosis? Answer. Syndrome of inappropriate antidiuretic hormone secretion, SIADH. 64. Patient with hematuria, proteinuria, and hypertension. Diagnosis? Answer. Acute glomerulonephritis. 65. Patient with a history of seizures and elevated serum calcium levels. Diagnosis? Answer. Primary hyperparathyroidism. 66. Patient with fever, migratory arthritis, and a new heart murmur. Diagnosis? Answer. Rheumatic fever. 67. Patient with jaundice, elevated direct bilirubin, and high ALP levels. Diagnosis? Answer. Intrahepatic cholestasis. 68. Patient with low blood pressure, rapid pulse, and pallor. Diagnosis? Answer. Hypovolemic shock. 69. Patient with polyuria, polydipsia, and hypernatremia. Diagnosis? Answer. Diabetes insipidus. 70. Patient with a history of gout and acute kidney failure. Diagnosis? Answer. Acute urate nephropathy. 71. Patient with high fever, petechia, and thrombocytopenia. Diagnosis? Answer. Dengue fever. 72. Patient with a history of hepatitis B and a mass in the right upper quadrant. Diagnosis? Answer. Hepatocellular carcinoma, hepatoma. 73. Patient with decreased consciousness, hypoglycemia, and hepatomegaly. Diagnosis? Answer. Hypoglycemia due to liver disease. 74. Patient with anasarca, massive proteinuria, and hypoalbuminemia. Diagnosis? Answer. Nephrotic syndrome. 75. Patient with multiple joint pain, butterfly rash on the face, and proteinuria. Diagnosis? Answer. Systemic lupus erythematosus, SLE. 76. Patient with hypertension, hypokalemia, and elevated aldosterone levels. Diagnosis? Answer. Primary hyperaldosteronism. 77. Patient with shortness of breath and pleural effusion. Main diagnostic test? Answer. Thoracentesis. 78. Patient with acute kidney injury caused by tubular necrosis. Supporting diagnostic test? Answer: urinalysis. 79. Patient with dysphagia for both liquids and solids and esophageal dilation. Diagnosis? Answer: achalasia. 80. Patient with chest pain, fever, and a pericardial friction rub. Diagnosis? Answer: acute pericarditis. 81. A 45-year-old male patient presents with left chest pain radiating to the arm for 20 minutes. ECG shows ST elevation in leads V2 V4. Diagnosis? Answer: acute anterior myocardial infarction. 82. First-line medication for a hypertensive patient without comorbidities? Answer: ACE inhibitors or ARBs. 83. A patient with hypertension and proteinuria. Recommended antihypertensive medication? Answer: ACE inhibitors. 84. A patient with diabetes mellitus, HbA1c 9%. Recommended first-line medication? Answer: Metformin. 85. Main complication in a patient with chronic kidney disease? Answer: anemia due to erythropoietin deficiency. 86. A patient with a history of right upper abdominal pain, fever, and jaundice. Diagnosis? Answer: acute cholangitis, Charcot's triad. 87. The most sensitive test to diagnose pulmonary tuberculosis? Answer: microscopic examination of sputum for AFB, Zeil-Nielsen stain. 88. A patient with epigastric pain after eating and a feeling of fullness. Most likely diagnosis? Answer: functional dyspepsia. 89. A patient with a chronic cough for more than 3 months per year for 2 consecutive years. Diagnosis? Answer: chronic bronchitis. 90. A patient with acute dyspnea and wheezing. Diagnosis? Answer: acute asthma exacerbation. 91. A patient with bilateral leg edema and lung crackles. Most likely diagnosis? Answer: right heart failure. 92. The most important laboratory test for systemic lupus erythematosus? Answer: ANA, antinuclear antibody. 93. A patient with microcytic hypochromic anemia. Most likely cause? Answer: iron deficiency. 94. A patient with acute asymmetric joint pain in the big toe. Diagnosis? Answer: gout arthritis. 95. A patient with unilateral leg edema, redness, and pain. Diagnosis? Answer: DVT, deep vein thrombosis. 96. Anticoagulant used for the prevention of venous thrombosis? Answer: heparin or warfarin. 97. A patient with pale skin, weakness, and Hb 7 grams per deciliter. Most likely cause of normocytic normochromic anemia? Answer: anemia of chronic disease. 98. A patient with elevated ALB and AST and positive HB-ZAG. Diagnosis? Answer: chronic hepatitis B99. A patient with high fever, chills, splenomegaly, and a history of travel to an endemic area. Diagnosis? Answer: malaria. 100. A patient with recurrent diarrhea, malabsorption, and dermatitis herpetiformis. Diagnosis? Answer: celiac disease.